The NHS has invited members of the media to learn more about the inpatient experience here at the new St. Catharines site.
We've got a lot of nice features in the inpatient unit. As you can see from yourself from the tour that we've done, there's a lot of single rooms. We do have two 4-bedded rooms for patients, but they have the facility, if the ministry dictates, to actually put a wall up so we can make them into single rooms in the future if that's what's required. The thing I like most about the inpatient units at the moment, to be honest with you, is the window. We have a window in every single room for the patient, so the patient's got continual daylight coming in during the day. And it also gives them a view, because a lot of the time where the patients are at the moment, they can't even see outside. So if they're there for a long stay, it's nice for them. We have 4 decentralised care stations, which is going to be totally different from what we do at the moment, where it's just one nursing station. So it's going to give the nursing staff a lot more room. And also the physicians, when they come up, the physiotherapists, the OT, they're going to be at the care station where the patients are that they're actually caring for. So they're going to be able to see their patients. So that's a fantastic new change.
What are some of the main benefits that patients will get here that they're not getting at the general?
The main benefit, I think, for the patient here is that they're going to get more nursing care, more physiotherapy care. Because the units are set out exactly the same way, every single member of staff, no matter which unit they're on, is going to know where things are. So they're not going to waste 20 minutes looking for the EKG machine. They're not going to waste 20 minutes looking for the Dynamap to take a blood pressure. Everything's going to be in a specific place on every unit. So that is definitely a very positive thing.
Dr. Chan, tell us about the physician recruitment that is going on.
Having this new hospital here has really been a big draw to get new physicians to come here. What we're doing in terms of creating a system that will provide the best care for our patients, that's going to be also good for physicians, has also been a big draw. So we actually have been very successful in bringing new physicians to the system. Successful actually to the point that next week we are implementing 3 new clinical services, which we have never had here before. We're going to have officially a cardiology service for the first time at the Niagara Health System, which starts on Monday. So we will have a dedicated cardiologist available 7 days a week. We'll also have a respirology service, which is a lung specialist, and also a general internal medicine service. And even with this transition, we're working on building even sort of a more comprehensive model, working with all of our physician partners, to see how we might more efficiently deliver this care. So this is really just the first step, and there's more to come, and actually more physicians coming later in the fall. So I think that's a very exciting development.
Christina, as an RN, what does the new health complex mean to the frontline workers?
For the frontline workers, it's a very exciting time. We're working hard to create new processes. We're using a lean philosophy, which is inherited through Toyota's methodology. It's just to create a better way of doing things, creating more change for the new hospital. We're starting to implement some of those changes in the old hospital now, so that we're ready to bring this forward into our new place of work.
Now, what features of the inpatient unit really stand out for you?
I really am excited about the 80% private rooms. This allows for the patients and families to have a real private space. They also are able to have more efficient, effective care. They should look forward to a clean environment. Infection control is a very important aspect of this new hospital. We have a lot of receptacles outside the door. It's a unique feature that we have in this particular hospital, where it doesn't allow for it to stand out in clutter the hallways. It's built right into the wall. It's a stainless steel, so it's easy to wash, and you can keep your personal protective equipment in the wall, and it allows for easy access in and out of the room as well.
Now, how will these improvements benefit the hospital staff, yourself, and the rest of the staff?
The whole outlay of the hospital is just so totally different from where I'm coming from. It's a lot cleaner, there's a lot more space. You have a staff room in every unit, which we don't have at the moment. The staff have to go to the downstairs cafeteria. You have all the facilities on hand, like I say, from that point of view. You have a Tim Hortons downstairs, so a lot of the staff are excited about Tim Hortons. And I think the fact that we're looking at all our care processes to move to the new build, that's a very positive aspect. So we're getting rid of all the old processes, looking for better patient care and gearing everything towards that. So when we come to the new hospital, we're going to be providing a better patient experience. So that's very positive for the staff too.
The St. Catharines site is on budget and on time, and will be completed by November the 26th and open for patient care in the spring of 2013. Reporting for The Source, I'm Bob Romeo.